So when you get ready to do your head and toe assessment, the first thing you want to make sure you do is introduce yourself to your patient. So I'm going to come in and I'm going to ask my patient to state their name and date of birth. And what am I comparing it to?
Their wristband.
Their wristband. What's your name and date of birth?
Yolanda Henderson, 3793.
Okay, and I tell them, Dr. Mcgill, I'll be your nurse for today, and I'm going to do a head-to-toe assessment on you. You may have some moments where I touch you, but I'm going to try to let you know where I touch you before I do that, okay? What brings you in today? Chief complaint. Why are they here?
Headache.
You have a headache?
Yeah, constant headache.
Okay, have you taken anything to relieve that headache?
Tylenol.
Does it work?
For a little while, then the headache comes.
How long is a little while?
For like 4 hours.
For 4 hours? Okay. Then it comes back?
Yeah.
Okay, is there anything that you do that makes it worse?
Not really. They just come off and on.
Okay. So then you're going to start head to toe, right? So we're going to look at a patient is awake, and whenever you're doing your head to toe assessment, you're going to have to talk to me and tell me what you find. So patient is awake, alert, and oriented ×3 because she knew. Do you know where you are?
Yes.
Where?
University.
Okay. And she knew why she was here. Did anybody? You want to assess if the person brought any family with them? Did you have anyone to bring you to the hospital today?
No.
Do you live with anyone that can take care of you when you go home?
Yes.
Could somebody come get you if you needed someone to drive you back home?
Yes.
Okay. The frequency of these headaches, how often do you have them?
Every other day.
Okay. So we looked at family support. We looked at her speech is clear. She speaks English. We looked to see that she has good knowledge of what's wrong with her, so she understands her illness, her view of her illness. All of that is under that neurological, that patient interview part on your checkoff sheets. So you need to make sure you adhere to that. You understand what's going on that. So then from there, I go ahead and I look at her head. She's normal cephalic. I don't see any asymmetry in her face. She has a relaxed appearance. She's cooperative with me. So I'm going to go ahead and start with her vital signs. Do you have hypertension or high blood pressure?
No.
No. What does your blood pressure usually run? Do you know?
120/80.
Okay. Can I see your arm? Okay, you can relax. I got 118/68. Let the patient know what you have. From there, I'm going to move on to her skin. Her skin is warm. It's dry. You do have to note if they have any tattoos, wounds, lesions, piercings. All of that needs to be noted in your assessment. So you would say a patient has tattoo, on her right hand, inner hand, on her left arm, wherever else there are. You have to note those things. Then you're going to move on. She doesn't have any IVs, any unnecessary piercings, just 2 in her ear, I guess. We'll find out if there's more. Then you're going to move on to her respiratory system. And you're going to listen. Breathe in. Every time I move my stethoscope, I want you to take a deep breath in and breathe out, okay? Okay, roll over to the side for me. Same thing. Okay, you can roll back over. So you want to note respiratory rate was whatever it was you got when you were assessing it. That the rate was 12. The rhythm was regular. She doesn't have any use of accessory muscles. Her long sounds are clear in all lobes. We're not going to have an oxygen saturation machine, but if you had one, you would say oxygen saturation was whatever on room air. Okay? She doesn't use oxygen at home?
No.
Okay, so you ask the patient, do they use oxygen at home? Any other abnormal? She doesn't have any artificial airways, so she's breathing naturally on her own. Then we're going to move to the cardiac system, so we're going to listen to the heart. Where are we? What's that? Aortic. Pulmonic.
Major. Tricuspid.
Okay. Then you note clear S1 and S2. No S3, S4 noted. So what am I telling you? I hear the lub-dub. I don't hear murmurs or gallops. Right?
Mm-hmm.
Okay. Heart rate is whatever, you know, the rate is when you assess it. And then you said that the rate was regular. Have you had any problems with your heart?
No.
Are you on any medications for your heart?
No.
Okay. So then at this point, we got to test the peripheral system. We already know what the blood pressure is, right? Because we already assessed that. Then you're going to come here and you're going to test the carotid. And all you're doing is testing for symmetry instead of checking for the rate. Because we check the rate when we listen at the heart, right?
Mm-hmm.
She has good pulses. It's +2 amplitude bilaterally in all peripheral pulses except for her feet was +1. And that may be because she has her socks on. I could take her socks off and do better. Is it still recording? Is it black? That one black too? It's still recording? Okay. All right. So then I've checked her respiratory, cardiac, periphery, her integumentary. Now I'm gonna move to her genital urinary. How many times do you urinate or pee a day?
5 or 6 times.
When was your last bowel movement?
Yesterday.
When do you go every day with a bowel movement?
Yes.
That's your normal pattern.
Yes.
The last time that you urinated, did you have any burning or tingling sensation associated with it? Have you had any difficulties with urinating or having bowel movements? No. Any problems with your stomach? No. Okay. Then what are we going to do? Listen for bowel sounds. You note the contour of the abdomen is even contour, even distribution. That's there. The color is even. And so then we go to the belly button and we identify our quadrants. So we got 1, 2. And when you hear bowel sounds, you note if they're normal gastric. Then we're going to know her piercing, right? When was your last, since she's a girl, when was your last menstrual cycle? Last month? Okay. Long as it's been a month, then we won't go into pregnancy, right? If it's been further than that, then we have to ask, are they on birth control or any forms of that? All right, right now I'm going to ask you to do a series of tests. I'm testing neurological functioning. If you would, and then you have your pen light. I don't have mine with me. So you're going to go ahead and test for reaction. Ask the patient to look up, look down, look towards Bree, look towards this way. Okay? Now, look to the right, no jerking. Look to the left, no jerking. Okay? Then, I'm going to note that her speech is clear, because that's neurological as well, right? Okay? I'm going to ask the patient to grab my hands. Squeeze hard as you can. Okay. Put your arms down. Lift your arms up. Against my hands. Lift up. Okay. Put down. Lift your legs up. Lift up. Okay. Put them down. Lift your feet. Lift them up. Okay. Put them down. Raise your leg. Any leg you choose. Alright. Bend the knee. Okay. Put your ankle to that shin. Okay. Put that leg down. Raise your leg up. Bend your knee. Put your ankle to that shin. Okay. Put your leg down. Any pain in your leg?
No.
In your back?
Yeah.
Your back hurt? How often?
Every once in a while, especially at nighttime.
Okay. What do you do for that pain?
Nothing. Just take a painkiller, like a Tylenol or something.
Okay. Can you get up and walk for me? Walk to the scale. Turn around. Walk back. So do a salute. Pivot. Okay. You can get back in the bed. Any problems with that?
No.
No. Okay. So we have assessed her orientation, alertness. We looked at her skin, her head to toe, neurological, respiratory, cardiac, periphery, abdominal assessment, genital urinary, and we looked at neuro. It's a full body assessment. So if it was something wrong, we can explore more. Like if she said, I can't really feel you pushing on my legs, then I would do a neuro test, right? And we do microfilaments and all that stuff to see where exactly, what nerve is the problem. But an overview of a general assessment, there it is.